Welcome to Talk About here on Shaw TV North Island. My name is John Twigg, and we have a relatively serious show today with one of the most important people on Vancouver Island. Yet few people know who she is. It's Dr. Charmaine Enns, and she's the Medical Health Officer for North Island. Dr. Enns, or Charmaine, thanks for coming in.
Thank you, John. I appreciate the invitation.
Well, the occasion is that you recently gave a presentation to City Council on the state of health of the population in the region, and it made page one in the Mirror. Campbell River health picture devastating. Mind-blowing is the headline here. Whoops, there it is. And the editorial they did, that the Mirror did, devastating health report is a call to arms. And meanwhile, the Courier had a different story. Doctor drops sobering statistics on council. So there's sort of like two different approaches to your report, the same report. What did you think of the media coverage and then the reaction to the report?
Thank you for the question, because actually I think that some of the headlines were a bit over the top, actually. I didn't feel that the information I was providing was actually devastating or mind-blowing. I actually did also provide some positive statistics.
Yeah.
And I think it's important that we balance out what's working and but where the opportunities are. And the whole purpose of providing the local health area health report is so that there's an understanding of the health of the population as a whole, yeah, and what interventions can be taken to improve that health. Because if we don't know where our gaps are, we can't actually make progress.
Yeah.
So every local health area on Vancouver Island, there's 14 local health areas, all of them have challenges in something.
Yeah.
Nobody gets a perfect health report. That's just not going to happen anywhere.
Yeah.
So in other areas where the medical health officers have provided health area reports, this trend seems to be the same, that there seems to be a pickup of stories on the negative indicators with headlines that seem to take it a bit out of context.
Yeah.
So I just want to say that I don't think the health report is devastating,
yeah,
and I don't think it's mind-blowing, but I think there is some good information in there that should help inform the community, the decision makers, on areas where there could be not only opportunity but improvement, yeah, for health of the population.
Yeah, I'd certainly say it was interesting. And the PowerPoint, I think, they posted it on the city website, I believe.
Yes, I understand that.
Yeah, so folks, if you want to see the report, www.campbellriver.ca, and then you have to search for it a bit. But the presentation you gave to council will be there in the council streamcast as well.
Right.
But what were some of the highlights that you think were in there that perhaps got overlooked a bit?
So I had 10 minutes.
Yeah.
To provide, a snapshot with a broad brush of a population that's over 40,000 people.
Yeah.
So that's not an easy task to do in terms of positives and negatives. So we do tend to focus in on the areas that are more likely needing improvement, because
yeah,
we only have a short amount of time to make
yeah,
the pitch.
Yeah.
So one of the things that I think is important is that didn't maybe get enough attention is the changing demographic.
Yeah.
So the population is going to change.
It's the aging.
It's an aging population, which is okay if all age groups are going to age together, or move forward together, but they're not. Actually, it looks like if you model forward, there's actually going to be a decrease in the proportion of population that's 25 to 45. That age group that's going to be really important for the workforce, for the tax base, for being caregivers. So yeah, that's something to be aware of. It's important.
I'm going to interject there just a bit. There's a natural aging process, but then there's also a move-in factor. I mean, the Economic Development Office here in Campbell River has been trying to attract seniors. So we're kind of maybe getting a double whammy.
Well, possibly, but you need jobs to attract young people.
Yeah.
So employment is going to bring people here.
Yeah.
There's lots of areas on the island that are challenged in terms of employment and employment opportunities, and to
Yeah.
be able to retain and attract a younger age group.
Yeah.
So that just makes, that's important information for planning, right? And
Yeah.
for services.
Yeah.
And
About the size of the hospital, for example.
yes, sure. But you know, I came with the local health area report because my emphasis is not on the acute care system. My
Yeah.
emphasis is upstream of that,
Yeah.
on the population, on the community, on prevention, health promotion.
The outcome of kids born to young mothers.
Yes, and the importance of the early years. So that is something that I think is important that we highlight in terms of the early development, not just for Campbell River, but for all of our communities, in
Yeah.
all of our areas, that we have to maintain that understanding of the importance of the early years in terms of the trajectory of someone's life course. So
Yeah.
those early years where kids don't have a choice on anything, on terms of their determinants, actually set them up for the rest of their life for their health and
Yeah.
wellness. So that's an important message, not only for Campbell River, but for all areas. And Campbell
Yeah.
River is doing some things very well in that area.
Oh, I was going to interject a bit that actually, despite the high numbers, the outcomes are still very good.
Well, Campbell River should feel quite good about that in the early development index. You score higher, you score better, I should say, in social vulnerability. So that means children are socially more prepared before they go into school. Also for communication skills.
Yeah.
Children in this area score better than the rest of the island in NBC.
Huh.
That's good. So the indicator, though, about physical preparedness or the physical and health and activity of kids needs some work.
Yeah.
But that is something that you have a network in the area called the Campbell River Family Network, which is a coalition of agencies in the early development work who track these indicators, and then they collectively work on improving them. But it's naive of us to think that we can actually make progress in these areas based on agencies and services.
Yeah.
I think one of the things that was overlooked in response to your question was the collective response of society. It's not just about the agencies and the providers doing the work. Because, for example, with the early years and childhood development, that's a very complex issue with a multiplicity of factors that contribute to that child's outcome.
Yeah.
Genetics.
Yeah.
Your family environment, what that family looks like, how that family functions.
An extended family versus a single parent.
Exactly. Your neighborhood, and the cohesion or the non-cohesion in your neighborhood affects those early
Yeah.
years. Those
Yeah.
are not agency driven.
Yeah.
Those are society driven.
Yeah.
So you don't get to pick your genetics. You get what you get.
Yeah.
So just an awareness of and the agencies are one piece of a pie, of a much bigger pie, that if we can all be aware of and invested in,
Yeah.
we will then be able to collectively make those, provide those supports to young families, to kids, to
Prosper.
prosper. And
Yeah.
if our kids prosper, we all prosper.
Yeah. Now, one of the things that I think one of the counselors asked you, like, well, what would you recommend? And at the top of your list was subsidized daycare.
Yes, isn't that interesting?
Yes. Is that a health issue? Well, of course it is.
Absolutely, yeah.
But I have a little editorial here, and I don't know if it's going to pop out. Yes, subsidized or private sector daycare. It's an economic issue. Michael Campbell on June 26 on CKNW was ranting about that ignores that somebody's got to pay for it kind of a thing. Well, having daycare enabling a mother to work, subsidized daycare, is good for the economy. It creates a job, it boosts the GDP, but and correct me if I'm wrong here, there's other things too, like a mother who's able to learn a skill, say early in her 20s, will be self-supporting in her 30s and 40s and 50s.
Absolutely.
So okay, there's an initial investment of having subsidized daycare, but it pays dividends for decades.
Yes, and Quebec has been a leading province in this. They actually, for every dollar they spend, they now get back $1.05. They're
Wow.
actually making money on subsidized childcare from a provincial perspective. They are our example in terms of provincial intervention. So in British Columbia, there has been a push for the province to consider something called $10 a day childcare.
Yeah.
So that means that every family, if they want childcare, has the opportunity for universal, high quality, accessible childcare for $10 a day. If you only work part-time, you'd have to pay $7.
Wow, that's. Now, what about training daycare workers? Is that a problem? Is that an issue? Is it an opportunity?
So there's a couple things. So our early childhood educators, really important people in our societies and in our community, really important. But they're very poorly paid.
Yeah.
There's not a lot of incentive to go to school and become an ECE, or early childhood educator, when you come out and make about $16 an hour. So we're investing very little money in the employment of people who invest heavily into the health and well-being of our children.
Yeah. Do you think the city should step in there because the province isn't doing it?
I don't know, but I think certainly the city could keep advocating through like UBCM.
Yeah.
But the city could find its own solutions, maybe. I don't know what the answer is,
Yeah.
but I do know that subsidized childcare that makes it that is high quality and accessible and affordable will ultimately, as you said, pay dividends back to us as a society.
Yeah. Is that like a means test thing too, or is it subsidized for everybody?
It would be subsidized for everybody, and if you the proposal to the province is if you make less than $40,000, it's free.
Huh.
So you brought up some examples of economic advantage, and there's huge advantages to businesses. Because now businesses have employees that are at work every day.
Yes.
There's reduced absenteeism, there's higher productivity, there's lower turnover of staff because they're not always struggling to be able to find people because they can't get childcare.
Yeah.
In BC, families spend next to their mortgage more on childcare than anything else.
Yeah. Back in the 60s, and I was there, I remember some of it, we were advocating for daycares in businesses.
Yeah.
And yet we don't hear so much about that, though I think there's probably a few in town. But, like the new hospital, will it have a daycare for the nurses?
That's a really excellent question. As far as I know, no, but I'm not privy to all of those decisions.
Yeah. So how long have you been the North Island Health Officer? Is that the right title?
Yes, I've been the medical health officer. This is my 11th year.
Wow.
So yeah, I came 11 years ago.
Where were you before?
I was a family doctor before I specialized, working in various places.
On the island, or?
Yes, West Coast and in Africa.
West Coast?
The West Coast, i.e. Tofino,
Oh.
Esperanza, Gold River, Tassis.
Well, that would be challenging.
It's fabulous. We have a beautiful coast on Vancouver Island.
Yeah. Do you get to do medicine once in a while?
Yes. Yeah,
between the fishing and the hiking and the kayaking and all that?
Yeah. No,
now, you slipped in Uganda there. What was happening in Uganda?
So I've actually had a number of trips to Uganda, mainly around maternal and infant mortality and water projects, drinking water.
Well, we'll get to water, but Ebola's in the headlines. Mm-hmm. How serious, should we in Campbell River be worried about Ebola?
No. Ebola virus is a virus that's transmitted through direct contact with blood, body fluids, or tissues of people who are infected. We have never had a case of Ebola in Canada.
Yeah.
If you are someone who's going to West Africa or to areas where there is a significant amount of virus, and there's obviously precautions that those healthcare providers need to know about and take.
Yeah.
But for us in Canada, it's newsworthy, but it's not a concern for us.
Yeah. Okay. Getting back to your report again, I think we kind of glossed over the drug problem. Let's give you a platform here.
So I did present that as a statistic. Again, I felt, I'm a public health doctor. I'm a population health doctor. So sometimes as a physician, we have to give news that's not easy news,
Yeah.
but it'd be wrong not to tell you,
Yeah.
right? So the statistics show that for the Campbell River area, of all 14 areas on the island, Campbell River ranks second in terms of the contribution of suicide and illicit drugs to death. So it's an important topic because it reflects some bigger issues probably in communities or families, and it has opportunities for mitigation or prevention or health promotion or services or supports or so again it's a broad stroke statistic for the whole area, but I think it's worth being aware of and paying attention to.
If Campbell River has one of the worst problems, maybe we should have a safe injection site? I don't know, maybe we already have one.
No, we don't have any on the island. There's only one in Canada actually, and it's in Vancouver.
Yeah.
There's lots of ways to solve problems,
Yeah.
and there's more than one usually. So again, my bias is to prevention and promotion.
Yeah.
So, but the reality is that people's lives have started long before we get anywhere close to being involved in their life.
Yeah.
And so, and people don't choose to have addiction problems or nobody wants to be an addict. Nobody wants to live on the street, right?
Yeah.
But once those things happen, we need to have the services to support people and to reduce harm as much as possible.
And that brings to my mind the homeless shelter that we had, the low barrier shelter that we had through the winter here.
Yes.
Apparently it's not going to be here next winter.
Oh, I didn't know that.
Well, there were the powers that be are maybe looking for a new location or lowering the barriers on an existing facility. But I'm getting concerned that I don't see any concrete actions.
So of course I'd be highly supportive of action.
Yeah.
I'd be highly supportive of making sure that people who are more on the fringes are looked after. We have a responsibility as a society to make sure that everyone is looked after.
Yeah.
So highly supportive of housing options or alternative housing. Treatment options, yes.
Yeah.
The whole spectrum.
Giving addicts drugs so they don't have to do break-ins.
Well, that could be a controversial. That is a controversial topic.
Well, occasionally we deal with controversy here on Talk About. We try and get at that. And so I'm going to slip out medical marijuana. What's your take on medical marijuana?
I actually think we need to step back a bit from medical marijuana and just look at our whole approach to marijuana in general. And I don't know what the exact answer is, but I do think we perpetuated a problem in our current system in terms of having it illegal and the way we manage it and the way we criminalize. And I think it would be good, and the way we've created a black market and a very lucrative black market. Yeah. I think it is worth stepping back and looking at that psychoactive substance from a public health perspective. Yeah. And harms and benefits, and looking at how it impacts society as a whole. So I'm not saying I have the answer, I don't know, but I do think it needs the conversation and it needs another look at. Yeah. Yeah. And I'm not sure we get caught up in the medical marijuana thing because that's what the federal government has decided, that's the route we're going to go. Yeah. I think we might be trying to put a Band-Aid on something without actually going back to the bigger question.
Those are good examples of the role of the medical health officer. In the earlier days as a young journalist in Vancouver, I got to know some of them a little bit and following the news. But you went from being a medical doctor to a, dare I say, an office doctor maybe? No patients?
The population is my patient.
Yeah, but you've been there 11 years. Obviously, you enjoy it.
I love it.
Yeah. But what when you go home at night and you think, boy, that was good, or what was it? What are the good things?
So what are the good things? When I first went into this, my boys were quite a bit younger, obviously. But I like how my oldest son said it. He said, "Oh, Mom, now you get to say, now instead of saving one life at a time, you get to save thousands at a time." So I loved his
Yeah.
take on it, because I don't know how many lives I actually saved, but I'm not looking at it just from a person anymore. Like in the office, it was all of your energy and all of your attention went on to an individual,
Yeah.
which is important.
Yeah.
But it can't be, and it shouldn't be, at the exclusion of the whole of the
Yeah.
rest of the population, because impacts or decisions that we make that affect populations ultimately come down to an individual. So it's not fair to separate them.
Yeah.
So I love that I get to not only be an advocate and a physician looking at population health perspectives, but within those populations, focusing in on subpopulations or groups of people that are not maybe having the same equity experience that the rest of the population gets. So that's one of the things that's very attractive to me, is the social justice, the application of the disparity or the inequity lens, to say why are we having these disparities in health status in some populations and not in others? What can we do different to even out the playing field? Because then you end up affecting a lot of people at one go, and not just one person at a time.
How often is the solution to throw money at it and then you find there's no budget?
We don't get money in public health. We get very little money.
Well, but even if you recommended something, it would probably, through the federal, provincial, municipal budgeting system, take years.
Sure. So we have, for example, in healthcare, and I'd like to challenge that we call it healthcare, but it's really disease care.
Yeah.
That's what we do. We look at diseases. We don't actually look at people's health.
Yeah.
We want to get them on a road towards health after they've come to us with a disease.
Yeah.
So I'm saying, from a population health perspective, we want to start upstream of that to health and wellness. So there is a reluctance to invest money on something that hasn't gone wrong yet.
Yeah.
We like to spend our money on the stuff that's already gone wrong, and then fix it.
Yeah.
So vaccines, for example, are an excellent example. We have to invest in vaccines to prevent a whole lot of vaccine-preventable diseases, which is sometimes a hard sell when you have to invest all that money for something that never now happens. Because people, that's what we want to do, right? We want to prevent that meningococcal case. We want to prevent tetanus and diphtheria.
Are you a fan of the flu vaccine?
I am a fan of the flu vaccine.
Okay.
And I get my flu vaccine every year. Are you a fan of the flu vaccine?
No. But I understand from the public policy issue that there's all sorts of vulnerable people, like nurses, who probably should. But frankly, I'm healthy, and I don't get exposed to a lot of bad stuff. So, yeah, for me, not so much. But I mean, I'm not campaigning against it either.
Okay.
If you didn't ask, I wouldn't tell. Okay, health outcomes for society, food and water.
Mm-hmm.
How important are those?
Well, they're right at the bottom of our triangle of of hierarchy of need.
Yeah.
So you don't have good water. If you don't have water, you're dead in 3 days. And if you have poor water, it just could take a little longer, right? Because of disease and other complications from bad water. So water's critical. Water is essential for life. Yeah. Food, we can survive quite a long time with crappy food, but to meet your potential or your maximum, appropriate nutrition that's accessible and affordable all the time is what people need.
Do you advocate for food self-sufficiency here on the island?
Oh yes, yeah, but we're not, from that food security perspective, absolutely,
Yeah, it's wonderful. We're getting all of this produce from California. They're running out of water.
Yeah, and they want our water.
Yeah, which, by the way, I'd be happy to sell them on a non-renewable basis. Auctioning it, yes. Cross-border contracts, no. But that's a different show.
But you see, that comes back again to the importance of water. We take water for granted, and we see water in our lakes, and we think we have lots of it. But there are a lot of other people looking at our water. So, we really can't take that resource for granted. Yeah. That's why, we work very hard as medical health officers and with our water suppliers, who are excellent, because they understand it is a resource that needs to be protected and managed. Yeah. Because it is so essential to community survival.
Yeah. But we do have surpluses. here on the island?
We have and we do, but that doesn't mean we always will.
No. I totally agree with management. Hep C, there was a little item, a few facts about Hep C. Is that in the high end or the middle or the low end of your priorities?
So Hep C is a reportable communicable disease, so it does fall under my area in terms of knowing about it.
Yeah.
I'm not actually responsible for the actual clinical management of that. That's up to the other healthcare providers.
Yeah.
But could you be a little more specific about Hep C?
With 3 minutes left, no.
Okay.
How about art on hospitals' walls? Are you in favor of putting art in the hospital to help people's mental health?
Oh, sure. What is there any reason why I shouldn't be?
Well, there's a reason you should, because the Arts Council here is lobbying to get art in the new hospital and the existing hospital. I think it's a great idea, but of course,
sure, you have
it
my
costs
vote.
money.
What doesn't cost
Yeah.
money?
Mental health. Do we? I think we know in BC there's a major problem. How bad is it around here?
So mental health, I think you've hit it on the head when you said it's a problem everywhere, and it is a problem everywhere, and across the demographic, so all age groups, right? And we see, and we hear that mental health is a number one priority in many of our communities and in our subpopulations, like for example the schools.
Yeah.
So it's important, and it needs to be taken seriously.
Yeah. Now, thank you very much for doing this.
Oh, you're
If
welcome.
people have questions, where do they find you?
So I'm on the VHA webpage.
Okay. Vancouver Island Health Authority.
Yes, Vancouver Island Health Authority. To email me, it's my first name dot last name, which is Charmaine.Enns at vha.ca. And I'm on the website in terms of contact information.
Great.
Yeah.
Well, Charmaine, thank you very much again.
But just
for doing
so you
this.
know,
Sure.
I'm responsible for the whole North Island, so that's 120,000 people. So
Is that like from Courtney North?
yes,
Okay. And is your office in Courtney?
yes.
But you're here frequently.
Oh yes.
Yeah.
Yeah.
Yeah, that's great.
Yeah.
Okay. Well, maybe next year.
Okay.
Okay. Well, there's Talk About. Thank you for watching. If you'd like to watch it again, it's on YouTube, Shaw TV North Island. And my own website, crnv.com, also has a list of all the shows with the links. This one may or may not be up there yet, but yes, it's worth watching. And thank you, volunteers. Thank you, Shaw. We'll see you again.